see. Let's. Guys, what's up? Dr. Heavenly here. Listen, I just came in for a minute. It is Friday, and it's a great day. And honestly, I want to talk about dentistry. The name of this segment is called An Appointment with Dr. Heavenly. Listen, I'm gonna answer all y'all dental questions, and this one here is about dental implants. Dental implants. What are dental implants? She don't have it up there, but you're gonna change it. What are dental implants, Stephanie? And what is the cost? How long they take, what is it, am I a good candidate, all that kind of stuff, okay? So basically, implant, y'all want to know, basically an implant is a titanium screw that goes in the bone. That's what it is. It's a titanium screw that goes in the bone. It's for people that are missing teeth. If you're missing one or two teeth or something like that, a lot of times we will decide to do an implant because we don't want to touch the adjacent teeth. It used to be a time before implants. Y'all probably don't remember this, but it was a time where we just did, yes, you can show the flyer. Yeah, we just did bridge work. We just did bridge work, and bridge work was simply that. We had 3 teeth, 2 teeth there, and 1 tooth was missing. So we prepared the adjacent teeth, the tooth on this side, the tooth on that side, and then cemented it in with an artificial tooth, which we call a pontic in the middle. Problem is we were cutting down good tooth structure to get there. So now that we have dental implants, and dental implants have come a long way, y'all. Used to be a time where we used to lose about half of them implants. Now the success rate of implants are very, very, very good. You can go ahead and put up the flyer, Stephanie. Very, very, very good. I think a lot of people don't realize there's 3 parts to implants. A lot of doctors will brand and say, an implant is $19.99. The implant is $19.99, but you also need an abutment and a crown. Put the flyer up, Gail. Yes, show the flyer. Yes, please. Let's see, show the flyer. Yes, put the flyer. Why she take it down? Anyway, so I was just in here to see if y'all had any questions about dental implants. I'm gonna do a series because I want y'all to understand what dental implants are, because so many people have a question. And they want to know what an arch is. The arch, you have an upper jaw and a lower jaw called the maxilla and the mandible. So when I say something per arch, the arch is the top arch and the lower arch. So there are 2 arches. There are 4 quadrants with the same thing: upper left, upper right, lower left, lower right. So when I say that, that's quadrants. Y'all got any questions about dental implants? Because I'm gonna go into it heavily right now. We know you the best at doing this, but you know what? I just like to educate people at this point with what's going on in the world. What's going on in the world now? We got to take some shifts and make some shifts, because I think that times are changing, and we need to focus on our craft. Point with Dr. Heavenly, they go a good flyer. What is an implant? The implant is the titanium screw that goes in the bone. That sounds painful, but it is not. It is not. When we do an implant, when you come in the office, basically we numb you up, and y'all know that's a shot. But we have a technique that we use with different types of anesthesia that do not sting as much. So we place topicals like oral gel or something like that. We got a real strong topical that we put around the area that we're going to inject, right? So that makes it less likely for you to feel it. Some people are more sensitive than others, and I tell my patients all the time, I got a lot of patients that smoke marijuana. If you smoking marijuana, it's going to intensify your senses, meaning you're going to feel more. You're going to feel it more. You know what I'm saying? And that's just what it is. That's why people smoke it, to intensify their senses. They can see better. They can smell better. They do it for the sex, whatever. But if you come in my dental office and you smoke, I don't know where it's legal or what it ain't, but you're going to feel more if you do. Okay. So come in. We can actually, if you're real nervous, some people are, we have nitrous oxide available. That's the laughing gas. We also have Valium. Valium's going to make you feel really, really relaxed. It's going to relax you a whole lot. And sometimes I have patients that can't take it at all, and we have to call in the anesthesiologist, and we just put you out cold. We put you to sleep with propofol. So, and that's extreme cases because I'd rather you be up. We have a way at Smiles by Dr. Heavenly, we have the latest technology to put that implant in, and we have what we call a CBCT scan. And we're able to scan your whole mouth through a 3D image so I can see your bone. I can see the density of the bone, how much room I have so I can measure the implant that I want to put in there, how much room I have from certain masses or structures in your mouth that you don't want to touch, like the mental foramen. The mental foramen you don't want to touch in the mandibular canal because that's where your nerve runs. And if we run into that nerve, it causes paresthesia, meaning they'll make you numb around here. So I'm able to see all of that digitally with a machine that costs hundreds of thousands of dollars. A lot of dentists don't have them. You know what I mean? And there was one time people were saying they could come to my office and take a CT and go back to the office, but I don't do that. Okay. The only way I think the safest way to place an implant is to have a CBCT scan. You got to have that latest technology, right? And then I keep implants in my office. So I have all the sizes. I have all the lengths and the widths of the implants. They come in different lengths. Okay. So once we put that titanium screw in your jaw, what we want it to do is integrate. We want your blood flow. We want your bone to grow all up in it. And usually most people don't have a problem. Young people don't have a problem. Healthy people don't have a problem. The only people that have a problem with dental implants integrating is if there's bacteria there, meaning poor hygiene. Secondly, diabetes. Y'all know diabetes causes poor wound healing in anything. So, and it's smoking and also vitamin D deficiency. Some people, you don't know why an implant didn't integrate, just some, but usually they integrate. 98, 99% of implants integrate, right? Once they integrate, and now they got implants. Now they say that you can put the crown on the same day. I don't believe that philosophy. I think that you need to give it time. Don't rush it. And then once I place my implant, I put on what they call a healing cap. I put a cap over the implant so nothing gets down in the implant, and it actually preserves the tissue around the implant. We call it emergence profile. Meaning so the gums grow the way they need to grow. So when we put the crown on, it's no problem. It's no sticking. It's no pain around the crown in the area where the gum is. So we put a healing cap on there. Usually we let the healing cap stay 3 to 4 months. 3 to 4 months. I always get you back for a post-op. Probably a week or two later after I place the implant, make sure nothing moved. There's no infection present. And we always give you an antibiotic and some pain pills. Usually it's minimal discomfort, minimal discomfort. But some people are a little different. Some people, usually my Caucasian friends, they have more of bruising. You might be able to see bruising because their skin is light. And different nationalities have different types of bone. That's just facts. It's not even, it's facts. Like Black people have really, really dense bones. So they have great bone for implants, right? And then, I'm going to do a couple of series on Appointment with Dr. Heavenly, talking about the all on X, which used to be all on 4. Somebody branded that name. So we call it all on 4s, where we place 4 implants up there and then replace your whole arch. I'm also going to talk about 3 on 6s, where I can actually replace your whole arch with putting 6 to 8 implants and doing 8 implant bridges at the top or the bottom. So implants are a great way to replace teeth. There are 3 parts to it. There's the implant, there's the abutment that goes on the tooth, and then that crown, the crown, just like you get on a regular crown, it goes on top of that abutment. Usually with me, I do screw retained abutment, so the abutment is already sealed in the crown, and I screw in the implant when we're doing our final on the prosthesis. Now, I know what y'all want to know. How much does it cost? How much time does it take? And things like that. Now the cost varies. Depending on what you need. I don't like to nickel and dime people when I see them. An implant itself runs about $2,000, just the implant, right? Sometimes we have to add bone. It might be a little bit more if we have to add bone, a membrane, that kind of stuff. The abutment that goes in the crown is probably about $600 to $1,000 for the abutment. And then the crown is about $2,000 to $2,400. So total per tooth, you're looking at about $6,000 to $7,000 per tooth. How much is your tooth worth to you? I see a lot of specials out there, but you want it done the right way. You want somebody that has the equipment, the supplies to do it the right way, that you can keep that tooth for a lifetime. Because what we do at Smiles by Dr. Heavenly is we guarantee that implant for a lifetime. We guarantee our veneers for a lifetime. We do. We just do. We guarantee them. Now, the composite veneers are a different story. I do not guarantee the composite veneers, and we're going to do a whole series on composite veneers versus porcelain veneers, the pros and cons. We're going to get into that. But right now, do y'all have any questions about implants? We got a few people in here. I'm in the middle of the day. But this is what I want to talk about now, y'all. A lot is going on in the world, but I'm going to stick to what I know, okay? This guy here says, unfortunately, I didn't take care of my teeth. I'm in Michigan. I've gotten dental scaling. I'm in the beginning stages of periodontal disease. Okay, now, it depends where you are with periodontal disease, and periodontal disease just means what it says. Perio means around, dental is teeth, disease around the tooth. Now, what periodontal disease happens is that over time, people don't brush or floss, or there's bacteria in the bone there, and there's acids around the teeth because that bacteria turns into acids and it eats the bone away around the tooth, right? So if you got a natural tooth here, it came in, right? And you're not brushing, flossing. It could be systemic reasons. It could be reasons of medication that you took or something. Cigarette smoking is a big deterrent. But at any rate, the bacteria that's around the teeth produces an acid that eats away at the bone. Your bone is supposed to be around the neck of the teeth. And when you come in, we actually probe you around those teeth to see how much bone loss you have around the teeth. Based on those measurements, we decide whether you need a regular cleaning or a deep cleaning. When he says he had a deep scaling, that means he had 4 or more millimeters of a pocket, meaning bone loss around that tooth. 4 is not bad. Once you get to 6 and 7 millimeters, and that's not much more, you want to talk about either spending a lot of money doing perio surgery where you may still lose the tooth, or you want to talk about extracting the tooth and replacing it with a dental implant. It's kind of up to you. We give you your pros and cons. A dental implant, once I placed it and it has integrated, it's very difficult to get it out. Very difficult. I almost have to drill it out. I have to drill around that bone to pull it out, right? So it's actually better placed than your natural dentition. But with a dental implant, you can get something called perioimplantitis, meaning the same thing. Once you get an implant, a lot of people feel like, oh, I ain't got to brush, I ain't got to floss, I ain't got to go see my dentist. Anything you get, you got to still see your dentist every 6 months. Sometimes I put people on the 3-month recall if they have very poor hygiene. So you want to see your dentist at least twice a year to make sure everything's going. We have medication that can kill the bacteria, kill all the bacteria. We got rinses that can help you, and we can keep your teeth for a lifetime, your natural teeth. But what I'm saying is, if you do everything right and you come and see me every 6 months and you do what I tell you, we guarantee our work. That's just what we do. Smiles by drheavenly.com. There you go. Let's see. I tell you the price ranges. The price ranges on what? An implant. I already went over that. Go back in the video. I told you the implant itself runs about $2,000. The abutment runs about $800, and the crown runs between $2,000 to $2,400, depending on what type of material you use it. Because there's a lot of different types. One crown is not significant to other crowns. Sometimes they got porcelain fused to metal, which is the cheaper crown, right? That cracks. I don't do those. I usually do PFZs or EMAX. EMAX in the front because it's beautiful. PFZs is beautiful, but it's more rich. It's harder in the back, so you can actually keep it a long time. So it depends on the material you use with your crowns. So it's almost $6,000 per tooth, or around $6,000-$7,000 per tooth, if you're asking a question. Oh my God, Heavenly, we need you in the UK. I'm here. You can fly to me. A lot of people from out of the city, out of the country, they come see me, Dr. Heavenly. I know this. I try to do all my jobs well. Married to Medicine is going to be off the chain. It is. But I try to do all my jobs well. And if you ask me questions, I can tell you the truth about anything that's going on. Let's see. Dr. Heavenly, I've been needing that appointment. I have a cavity, want to place the whole tooth. It was due to pregnancy and cigarettes. I quit years ago. I didn't have the money to fix it. Listen, one great thing about Smiles by Dr. Heavenly is we got financing. We can finance that darn thing down to a couple of $100 a month. We can get your work. We can get you financed. Depending on what you get, we can get you financed. If you go on my website, you can apply. You know what I'm saying? Within 5 minutes, or really 5 seconds. Once you fill it out, they tell you right away whether you're approved or not. Go to my website, smilesbydrheavenly.com. Let me even make a banner for that if I can. Let me see how I do it. Create a new banner. I'm going to put Smiles by. Let's see. I can't even spell. I can't see good, y'all. Smiles by drheavenly.com. And I'm going to take care of you, boopy. I love what I do. I really, really do. Add banner. I'm going to take this one away and add this one, smile.heavenly.com. Listen, so you go to the website, apply, and then you go to the website and you can actually make an appointment from the website, or you can call my number, which is 404-29-SMILE, and that should be on the banner, but hell, you know what I mean? Let's see. 404-29, and it's 297-6453, but you know, y'all know what it is. Y'all know what it is. 404-29. Shit, I'm doing the wrong thing. 404-29 SMILE. SMILE. I had that number for a long time. 404-29 SMILE. Dash SMILE. I can't find a dash. Okay, SMILE. SMILE. Is that how you spell it? That's how you spell it. Okay. But anyway, anybody got any questions here? I'm looking at the comments here and the questions. Okay. All right, here you go. The problem I keep running into insurance is crap. Yeah, it is. Insurance doesn't cover a whole lot, especially for cosmetic stuff. I think the insurance is just now started paying for implants, but you're almost doing better without insurance because, yeah. But yeah, insurance doesn't pay a whole lot. I say use the financing. I think your teeth are so valuable. That's just my opinion. I think that people without teeth cannot get the job. They cannot get the relationships. It changes your whole outlook on life. It changes your whole facial features. When I got my crowns done, it changed my whole look. Actually, it really did. So cosmetic dentistry is something you can get. I mean, and it's actually a fad right now. And I want to talk about that in my next video. And I'm going to do one right after this one because I'm going to do two. And I'm going to talk about the differences between composite veneers and the difference between porcelain ceramic veneers, the difference, the pros and cons. But implants, the pros are this: you replacing a tooth that you have missing. Usually it lasts a lifetime. Once we get it integrated, it lasts a lifetime. And con, I don't see any other than you got to take care of it just like your natural tooth, which is not a con for you, not a bad thing. But yeah, technology is amazing now. Smile.heavenly. We got the latest technology. We have a CBCT scan. We can do a 3D and see your whole images of your mouth. You see exactly where to place that implant, what size implant to use, and just make it seamless for you. And we're one-stop shop. We do it all. We do veneers, we do cosmetic crowns, we do implants, we do partials, dentures, and we do all on X's and we do 3-on-6s. If y'all don't know that, we're gonna do a video for that as well. But if you're missing teeth, there's no reason to have no teeth. And to me, your teeth are very valuable. So guys, I think I got all the questions here. Here, let's see. How do you know if the bone structure is compatible? I can tell by the CBCT scan. I can tell the density of the bone by that scan that I do. I can see it. I can see it. Okay. Give us a call, Smile by Dr. Heavenly. And our number is 404-29-SMILE. There you got it. Let's see. Let's see. I got you. 404-29-SMILE. Y'all see it. Let's see if I got any other questions right quick. It says, I'm too scared. It's scared people. I mean, that ain't God. Scared of what? Scared of what? I'm telling you what's going to happen. I never get implants. I'm like, okay, whatever. All right. Well, keep moving. How do you know bone structure? Okay. You are right. I work in corporate America and I'm embarrassed to go into meetings. Yeah, especially your front teeth. Even that side tooth. Y'all can act like people don't see it, but they see it. They see it, and it cheapens your look. It cheapens you. You know what I'm saying? If you meet a dude in the street, honestly, and he missing a side tooth, you already know he ain't about nothing. Either they don't got the money or he just don't know better. Nobody wants to walk around without teeth. So my whole thing is a woman without teeth is, you know, that's just unacceptable. But yeah, teeth are something you gotta have. You gotta have. You don't need the booty. You don't need all the other stuff. But you need your teeth. That's my opinion. Let's see. Let's see. Definitely. All right, guys. Give us a call, 404-29-SMILE, or visit my website, smile.drheavenly.com. Hopefully this has been interesting for you guys. I broke it down. The implant here, the abutment, the crown. If y'all don't have any questions, let me know if you have any questions. And other than that, all right. Well, that's it for this video. Y'all come and see me. I'll see y'all later. Bye. There you go.